Hey guys, it's Dr. Austin with Inver Chiropractic, and today we're going to dive into a couple of different things. One being the radicular symptoms, or the pain, tingling, numbness, things like that you feel going down one leg, both legs, and we're going to talk about how we can help you here in the office get some relief from those symptoms and that pain. So a couple of different ways that we get that pain going down the leg, or the more common ways that we see here, are from a disc bulge or disc herniation, and that you can see that here on this spine model. So this little red part kind of impedes upon that nerve, and it irritates it, and that's when you can get some of those feelings of the numbness, tingling going down the leg. That's one way. Another very common way that we see here is, I'm sure you guys have heard it, sciatica or sciatic type symptoms, and what that most commonly is from Piriformis Syndrome, and that muscle is actually in the glutes, and so you can feel that on either one or both sides if both are tight or irritated. The reason those occur is just from our posture and our everyday sitting and not getting the function, the mobility, the exercise that we need every day to help relieve some of that stuff. So here's what we can do in the office to help some of those symptoms. One, very important, guys, getting adjusted. Getting those bones aligned and sitting how they need to on the spine is going to help give that nerve from the disc bulge as much space as we can to allow that to function without being impeded upon by that bulge. There has been also some studies that have shown adjustments can actually help pull that disc bulge back in and relieve the symptoms as well. That's going to be huge. So getting the adjustments is a very big piece. For more of the sciatic, the piriformis portion, we can set you guys up with Beth Ann, our massage therapist, and she can really work on that piriformis to get that to relax and to not give the sciatic nerve that runs around or through that muscle. If with the piriformis relaxing, the nerve is going to be flowing much more freely, and it's not going to cause some of those symptoms that you're feeling. And for both pieces, the disc bulge and herniation and also Piriformis Syndrome, we can get you guys in the functional fitness center with our mobility expert, Josh, and he's going to give you exercises, stretches, some mobility work, things that we can do and that you can do on a daily basis while you're in the office and while you're at home, to really relieve the pressure on that low back, or to really work through a very tight piriformis muscle, or anything on that kind of posterior side, the hamstrings, the glutes, the piriformis, things like that, just to get you guys moving and to really practice on the mobility and the exercise portion to relieve those symptoms that you're feeling. And just getting up and moving more on a daily basis is going to not only improve those symptoms that you're feeling, but also just improve the overall quality of your spine, as well as the musculature that you're stretching and working on. So those are just a couple of different things we can do in the office. There are definitely many more options that we have, but we'd focus on those three today, and if we can get those accomplished, I think we'll be able to help quite a bit with some of the pain and radicular symptoms that you guys are having. So please, guys, any comments, questions, concerns, please leave them below. We'll get back to you as soon as we can. As well, if you like this video or found it helpful, please like or share it. Thanks, guys, and have a good rest of your day.